Hello, this is Bob Dennis, and I'm talking with my friend and colleague, Stacey Ravid, who just finished her PhD in nursing, and she's been a nurse for several decades. And the backstory is that a couple of years ago, we were having breakfast, and she was introduced to me by one of my students, actually, from one of my classes at University of North Carolina. And Stacey, now Dr. Ravid, told me that she was interested in getting a PhD, and we talked about different things she could study. She ended up wanting to do a study on micropulse ICES for pain. And I would like to interview her now. I'm smiling. I can't suppress my grin because I would like her to tell you about how this study was conducted and the way that she went through her doctoral process to study how people with pain used and responded to micropulse ICES. And I happen to know that a lot of it is kind of this petty academic stuff that I run into all the time. Better for someone else to experience it than me. And Stacey and I decided from a very early point in this process that I should not be involved at all to remove any chance of bias. And therefore, there's a lot of things about this study that Stacey just finished that I don't know. So anyway, Dr. Ravid, please tell us about the study you did.
Hi, my name is Stacey Ravid, and I just completed the study on the micropulse. I wanted to understand individuals' experience of using a non-traditional, non-pharmaceutical approach for pain relief, and that was the motivation for the study. I had actually spent quite a bit of time studying different modalities, different PEMF devices, different holistic modalities, and I had settled upon the micropulse for several reasons, one of which is because participants, patients are able to purchase it and use it for themselves in their own setting. That was important to me because patient autonomy is very, very important to me. I also chose the micropulse because it was safe. People couldn't injure themselves with it. It wasn't a substance that they were ingesting. So for those reasons and others, I selected the micropulse. And after an introductory email was sent to participants, to all the people that had bought the micropulse, I was really amazed at the response that I got and how many people responded. I selected a descriptive exploratory design because I was interested in understanding the patient's experiences from their point of view, and also this design focuses on commonalities in a group situation. So not only was I looking at their individual experiences, but I was interested in sort of a group phenomenon. There were 28 participants that I included in my study.
Okay.
And 12 were women, 16 were men. Their types of pain ranged from all different types of pain, and the years of pain also ranged from 44 years to acute of a couple of weeks.
Excellent. So first of all, I'd like to say I didn't know this until you just mentioned it, but you were talking about the importance of patient autonomy and access to the treatment and their ability to do this in their own setting, in their own home. And I can say, as a long-term sufferer of chronic pain, before I developed the device for myself, it's quite dehumanizing to have to go and beg for prescriptions. And they start telling you things like, you shouldn't be seeking drugs and things like that. I'm not a drug seeker. I was just looking for relief, right? And it's really terrible to actually be trapped in this system where you're completely dependent, week by week on somebody else's, mercy, and you're completely disempowered. And this is a well-known phenomenon with any kind of mammal, any kind of higher mammal, from mice to primates. If you take away their autonomy, you take away their ability to make decisions for themselves, they get sick. And I think that part of the problem with pain is the feeling, and you had looked into this, I know, feelings of helplessness. I mean, you couldn't do anything about it. and all that kind of stuff. So I think, for my opinion going into this, I think your approach to the study was exactly right. The other aspect of the study that I really like that you told me about already was that it was, observational, experiential, and we had discussed this at the beginning, letting people say what they want to say, because I think you'll agree, people said a lot of things that were very surprising, very informative.
Yes, I also would like to take a moment to thank the participants that took their time and energy and shared their stories with me. They were really incredible stories, and so thank you to those people involved in this study.
That's awesome. I'm still reading them. I mean, they're really remarkable at how honest they were with you and just how forthcoming. And I can tell you, because of the way we run the company MicroPulse, we're accessible. So anybody who wants to buy stuff from us, they can also email us. And I try to respond to every email. I know I miss some, or some fall through the cracks. That's because I have hundreds of them. But people send me these really personal stories that are quite touching very often. People thanking me for freeing them from the grip of some kind of terrible, pain that they hadn't been able to deal with. So, I know you listened to these and did whatever you were going to do. Did you record them? You recorded them, right?
Yes,
and then transcribed them? Is that what you did?
I recorded them and then I transcribed them myself.
I see. Okay. So yeah, but I agree with you. I'd like to thank anybody who was a participant in this study. We emailed it out quite broadly. Anybody who didn't pick and choose, just anybody who had bought our stuff, and some of them didn't buy it for pain, so we didn't. I imagine they didn't have anything to say, so they didn't participate. But I think we got a pretty strong response. I know you got a lot of responses. So here's the magic question that I would like to ask, and I know this is kind of right off the top, but in the emails that I get from people about using MicroPulse for pain, because I'm trying to perfect, the technology so people can use it. It's reasonably priced but effective. It's about 93 or 94% of the people tell me that they had a very good positive reduction in pain. And honestly, as a scientist, that's like red flags. That's like too good. You can't have done something that's that effective. There's very few drugs, for example, that are that effective. Very few medical treatments that are that effective. So the impression that I've had for many years now, I've been keeping track for about 7 or 8 years, is that it's about 93 to 94% effective. And some of the times when it's not effective, it's because people don't even try it. They just leave it in the box and everything. I don't know exactly what all the reasons are, or they don't set it up right. But then there's some people who don't respond. But what was your impression, not holding you down to a specific number, but does 93 or 94% sound unreasonable from what you were hearing?
Well, I interviewed 28 participants, and out of those, 27 had pain relief. Only 1 did not.
Wow. So that's over 90% for sure.
Yes.
Yeah.
Yeah.
Okay. Well, that's pretty good. And some of them have really significant long-lasting pain relief. Is that mostly what you heard?
It was all different types of painful conditions. And one of the most amazing things that I discovered in this research is participants that used the MicroPulse for one type of pain and had relief ended up trying it for all different types of pain, ranging from menstrual pain to headaches to mouth pain. One participant used it for vision, to improve their vision. Another participant used it for Alzheimer's, for their parent, to help in the reaction.
Yeah, it's interesting. I hear the same thing. People will buy it for one thing and then like it so much that they try it for everything else. So about 4 months ago, I put out a survey on SurveyMonkey and just put out an email to everybody and said, go ahead and fill out the survey. Got about 150 responses. And the main question I asked was, what do you use PEMF for? And what are you interested in using it for? And I can tell you, every single medical condition that I could think of, and I put it in this huge list, there was somebody using it for that, and at least several people who are interested in it. You just name it, like endometriosis, and doesn't have to be a pain condition. I mean, people are interested in it for all kinds of things that are unrelated to pain. And so what I hear a lot is, well, it worked so well for my pain. Do you think it would work really well for like a skin condition or something? And the answer is, I don't know. Mm-hmm. But you heard a lot of that, huh?
I did. One of the things that really amazed me were participants who used it for conditions in which they were about to have surgery. And
Yeah.
instead of having surgery, they used the micropulse, they had relief, and they did not have to have surgery. For example, shoulder pain.
I hear that very frequently. In fact, mea culpa, I'm guilty of that. I was going to have a right hip replacement, and I started using it intensively on my right hip like 5 years ago. Never had problems with it again. And now I was going to have to get a left hip replacement, as I think I told you a couple of years ago. And I've been using it on my left hip, and it hasn't recovered completely, but boy, it's sure manageable without surgery. So now, on the other hand, let me just say, I would not want to delay or defer or be at cause for causing anyone to delay or defer or avoid regular medical treatment for anything.
Absolutely.
I don't want to be there, and I don't think that anyone should do that, especially with a device like this that's totally experimental. So if you're thinking about that kind of thing, you really ought to actually work with your doctor or your surgeon on that, and make sure they understand, what you're doing, and that in fact, if you think you're getting better, are you actually getting better? And whatever you do, don't avoid or delay treatment on the hope or the dream that something will work that's not really proven.
Yes. This participant worked closely with their doctor, and they used the micropulse, and they did the testing, and the doctor said, you don't need the surgery.
Well, that's what my doctor said. And in fact, I'm going to see a surgeon in October, and I think he's going to tell me the same thing, because I think they're always surprised. They're like, well, this isn't supposed to get better, but it's getting a lot better. You're really not a candidate for surgery anymore, and that's been told to me now on 2 occasions. So, I cannot say that to somebody, but your doctor can tell you that. And I would, definitely not freelance this. I would definitely get a solid medical opinion before you make any decisions like that.
Absolutely. Yes.
So would you, what else would you like people to know about this study? We have it posted on the Flux Health webpage. Actually, it's going to be posted there, and I've got it available for people to download from the Flux Health forum. And I'm going to, once we finish this recording, you and I can review it, and then I can post it. What else would you like people to know about this study?
Well, a couple of things. Number one is that many of the participants had tried many other modalities and medications before they found the micropulse, and it seemed like there was a theme that the micropulse was a last-ditch effort. And many of them stated that they wish they had tried the micropulse before many other modalities. One participant in particular had become addicted to pain medications and alcohol. And upon using the micropulse and having pain relief, he said he was able to stop the alcohol and the drugs. I
have no pride. Let me just say, I handed a bottle of oxycodone back to my physician, and he was shocked. He took a step back, and he's like, "What? You don't want them?" And I said, "Actually, no, I don't want them. But most importantly, I don't need them." And that was several years ago for my back. And he's been in practice like 35 years or so. He said, "Boy, I've never seen that before. Nobody's ever handed me back a bottle full of, oxycodone." And I said, "Well, I'm happy to be the first, and I hope I'm not the last." So I'm totally simpatico with that person that you were talking to. And I think there may be more people who just don't want to say that, but I think there's a big psychological component here. And I'm not talking about placebo effect, because all of us, myself included, we tried everything and it didn't work. So if placebo effect was really going to work for us, it would have worked a long time ago before we ever got to PEMF. That's just the reality. But the other thing is, psychologically, a lot of us feel a lot better if we can control things ourselves. If we can control, when we use things, how we use them, and how we, if you know that you have a tool that will make you better, it's much better for you psychologically than knowing that you have to call your doctor and beg for an appointment so that you can beg for the intervention that they have control of for you. That to me, I think that's very unhealthy. That's perhaps the most unhealthy aspect of Western medicine, is that you're putting your health and your future in someone else's control.
Right. Another theme that I found was that participants used the micropulse in all different types of settings. Some would sleep with it, some would put it on and go to work and have it at work all day and then change out the batteries. One participant who drove long distances would use it while they were driving.
Mm-hmm.
And so there was a lot of flexibility in when and how they used it.
Well, that was by design, right? I mean, I put all my effort into making something as small and portable and safe and easy to use as I could. And then basically when people use it, they kind of have to tell me how they're using it, because I don't know. It's just like I make it so that they can wear around. In fact, I'm wearing 3 of them right now, 2 on my left hip and 1 on my back, and I'm in zero pain. But I go about my day. I work in a machine shop. I drive around and stuff like that now. And because I'm pretty well fully recovered from my stroke last year, it's 13 months ago. So now I'm back 100% and then some. But now I'm really struggling mostly with this hip pain, which is mostly gone. I can tell you from last year, it's mostly gone. But I wear a device all day, and then I sleep on a little pad at night, and I wake up without pain and all that kind of stuff. Basically drug free. Occasionally, I take a little something to, if I have a little relapse, but.
I was amazed at how many participants stopped taking medications. Once they found the micropulse, they said they just didn't need it.
Well, the opioid crisis, if I may, is a crisis of confidence, and it's a crisis of lack of ability of mainstream medicine to treat the core problem. I think that they would find that much more pervasive than people who are going to OD on opioids are people who take them but don't want to be taking them. And as soon as they can not take them anymore, they would be, like myself, perfectly happy to just stop. But you don't have much of a choice. I mean, what options do we have? You know better than I do. What options are there for really severe chronic pain? I think virtually none. There's very, very few that are effective. And I don't think there's an appreciation for the fact that people go that route because they don't have any viable alternatives, right? But you have found that if you give them a viable alternative, you put that power in their hands, and it works. A lot of people, and I would submit that more people feel that way than would tell either one of us, because it's a very intensely personal thing. If they were sort of on the edge of dealing with real problems with opioids and they were able to just cut it off, I think, my sense is that's a lot of people.
Right. And it's not just opioids. There are other medications that participants were taking, even basic aspirin or Tylenol, that they were able to stop taking. And those medications over time can be harmful for the body as well.
Absolutely. I mean, can be very damaging for your liver, for example, and things like that. And, one of the people who was in your study just happened to randomly be a person that I know. And she's contacted me once or twice and said she completely stopped using, ibuprofen and all that stuff. And she was just delighted, because I guess she wasn't really reacting that well to it, but she didn't have much choice. She had to be functional. So it's not just opioids. You're right. And then there have been other people, because I've had 2 or 3 people tell me this. And I think you told me, well, at least one person told you this. They were really getting involved in illicit drugs.
Yes.
And they were able to stop that, because they weren't doing it recreationally, I don't think. They were doing it out of just despair.
For pain relief. For this study, I asked 9 survey questions. And the last question I asked is, how has pain affected your life, work, and relationships? And that was one of the interesting findings from this study, to hear about the impact that pain has had for all these participants. One of the participants has been in pain for 44 years. They injured themselves as a child. In their entire life, they had pain until they used the micropulse.
Isn't that astonishing?
Yes, and it was also interesting to hear how it affected them psychologically, emotionally. And one of the aspects of the study was looking at these participants holistically in how has the pain relief impacted their life in a holistic way, mentally, emotionally, physically, spiritually.
Mm-hmm. And also there's huge impacts on the people around you. I know that my having pain is a huge strain on my family and my marriage and everything, because people who don't have pain, they really don't understand it. It's like psychologically, you can't understand and really sympathize with pain unless you are someone who's really experienced it. So I think the kind of study that you did, as I'm now learning much more about what you did now that I'm allowed to look at it, and study it. I think it's a very, very good approach. And I think that's the approach that we need for a lot of these medical conditions, especially pain, is to take a much bigger holistic look at the picture, because it's much more complicated than, person's in pain, they made bad choices, now we got to give them drugs. It's way more complex than that. It's way more complex, and it's much more nuanced, and how people respond to things, and the psychological and social and economic and other collateral health impacts of pain, and they're dealing with pain and their treatment, and effective or not effective, and how they feel like they're in the system. And I think from what I'm seeing now, looking at your dissertation, I'm thinking you really captured a lot of that. What I'm hopeful you will be interested in doing, because I think you had quite a lot of people who wanted to respond to you, is, I guess, a larger study, kind of more inclusive. You got that in the plans, right?
Definitely, yes. I am going to do another study, and I would like to do a mixed method study, a quantitative and a qualitative study.
I think you should. I think, this much I know for sure. Okay, Stacey was dealing with a university, and universities have restrictions, and there's real restrictions on what you can and can't study, and you got to follow them. And that's just the way that it is. And I think that when you're privately responsible for your behavior, as a clinician or a scientist, you do get a lot more latitude in your choice of studies. I mean, in Stacey's case, you were a student, right? So you have to, for example, meet the requirements of a doctoral degree. But all that stuff is in your rearview mirror now, and you can focus 100%, and I hope you do, focus 100%, I'm sure you will, on what's really best for people, because that's the question I keep wanting to have an answer for. What is the very best thing you can do to help people who are in pain? And I think we share that question. And I would like to know, in the broadest possible sense, qualitative, touchy-feely, kind of kumbaya, huggy, but also very quantitative, give me the numbers, and really saying, okay, for these types of pain, you can expect this percentage of effectiveness, and that kind of thing. And I think those two things need to go together. I don't think you should do just one or just the other.
Right. I also think what's important for this type of study, and specifically the micropulse, is to find out what protocols work for people. How long should they put the micropulse on? Where? For what duration? For what frequency? And I think that's something else that would be important to address.
Precisely. So what we're planning on doing is basically through our forum and through the webpage and through some of our customers, we're going to just be contacting people, and you and I can talk about what study you want to do next, and, maybe involving, other things that you'd measure, maybe, whatever makes sense to you. And, you can follow it in any direction you want. Like, I personally would be very interested to know what kinds of protocols are on the devices and how they affect people. And this is a huge source of disagreement and argument among my medical colleagues. Some of them say, oh, it's got to be exactly this frequency and exactly this protocol, and that's what works for my patients. And then another one of them standing right next to him will say, well, no, it's a different thing. Different people respond different ways. In one day, I got an email from clinician in India. He's a rural clinician who deals with pain and non-healing ulcerative wounds. And he said the most effective use for your device is for chronic regional pain syndrome. And then I've had another clinician and an individual here in the United States tell me exactly the opposite. They say it seems to work for all kinds of pain, but it just doesn't work for CRPS. And these are all little anecdotes, right? And my sense is it may not work so well for CRPS. There's different contributing factors, and a lot of it I think is central, having to do with your sensation of pain. And so maybe directly working on the tissues that you think are producing pain, that's really not the cause of the pain. It might be more the way your brain is wired. I think that was the case for me. But it's interesting because different clinical people, and they will have a fair amount of experience. They'll tell me, oh, I had 6 or 8 people and they all did this and that all worked this way. Another person tell me just the opposite. So I think, when we do a study, the thing that I've been encouraging you to do is to keep these studies open. Remember that, and just let people enroll in them and then just follow them out for months or years and see what really works for most people, for most things, for the longest period of time. That's what I'm really interested to know.
Well, I look forward to researching the micropulse and helping people in pain.
Well, thank you so much, and thank you for doing this quick interview. And I
Thank
think
you,
we'll
Dr.
probably
Dennis.
talk about other stuff later, but this is good enough for one day. Okay?
Thank you. Take care.
Okay, thanks. Take care. Talk to you later.